Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you if you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn, and this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Synera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use, so you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, there's a little sticky area here that I will pull off, and then there's a little a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that has, you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that might have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area, and then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have, and if we were going to have her, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspect, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle.